Hello everyone, good morning. I hope you all are good. So today we are starting off with our next topic, that is types of psoriasis. So why are we studying types of psoriasis? It's because psoriasis appears differently in different patients. So it has different types of forms. So its clinical presentation differs, and we need to identify it so that we can make the proper diagnosis. So we are going to study the types of psoriasis. Okay. Chronic plaque psoriasis. This is the first type. What exactly is chronic plaque? We already talked about it in the previous video. And now we are going to study that this chronic plaque psoriasis, this is almost of 90% of cases. 90% of cases are of chronic plaque psoriasis. So it is the most common type, or you can say that it is the most common presentation of psoriasis. Okay, and then it has well-defined erythematous plaques. Okay, you can see here this picture. In this you can see the these are well-defined, demarcated plaques, erythematous on this red background. Okay, so these are the plaques on this red background with the thick silvery white scales. Over the background, over the red background, we have got thick silvery white scales. These are thick silvery white scales, and they mostly occur on the extensor surfaces. So the classic type of psoriasis, that is chronic plaque psoriasis, it mostly presents on the extensor surfaces, like on the elbows, on the knees, on the scalp, so and lumbosacral region. These are the most common sites of chronic plaque psoriasis. So if you get a patient with the psoriasis on these surfaces with this specific morphology and presentation, then you can easily say that it is chronic plaque psoriasis. This is the classical psoriasis, or it is also called psoriasis vulgaris. Okay, so this is the most common presentation of psoriasis which happens. Now, cutate psoriasis, it is another type of psoriasis, and you can see there here the clinical presentation differs completely from the previous one. In this one, you get small drop-like lesions. You see here, these are the small drop-like lesions, like water droplets. Where gutate specifically means that water droplets. Okay, so gutate is basically droplet, and gutate psoriasis, it means that its presentation looks like water droplet, and it has sudden onset. Okay, it usually affects children and young adults. So if you get a patient specifically in ages of for 15 to 17 or 18 age, then and suddenly he developed small drop like lesions all over his trunk and proximal limbs, then you can think of gutate psoriasis. Okay, and this is very important from clinical point of view. Streptococcal throat infection, that pharyngitis, sometimes a patient might get a pharyngitis, simple sore throat, and 1 to 3 weeks after the sore throat, not right after the sore throat, but you get 1 to 3 weeks of a time period, and exactly after that, their patient might develop this sudden eruption of gutate or small drop-like lesions over his trunk and proximal limb. So this is the distribution. Most of this appears on the trunk and proximal limb. So if such patients, such patients are present to you with a streptococcal throat infection that happened 1 to 3 weeks back, and now suddenly they are having these drop-like lesions all over their trunk and proximal limbs, and so you can easily say that this is cutate psoriasis. Okay, now let's talk about the pustular psoriasis. It is characterized by sterile pustules. You can see this one, this picture. Let me show you. These are the sterile pustules. Okay, we often associated a pustule, which is the collection of pus. Okay, and we often associated with the with bacterial infection, most commonly bacterial infection, but these are not associated with bacterial infection. They are sterile pustules. That means they do not develop because of any pathogen. Because instead, they are the clinical manifestation of excessive inflammatory response, specifically neutrophil manifestation. So once neutrophils collect in an area, they die, and then they produce this pus-like pustules. Okay, and but there is no specific pathogen, no bacteria or virus present in these pustules. So you get Sterile pustules. So pustular psoriasis, it is characterized by sterile pustules on erythematous background. So sometimes patient will be having an erythematous, that is red background, and on that red background you get these pustules which are completely sterile. Patient is not having any kind of sepsis. Okay, so this is pustular psoriasis. Now we get different types of pustular psoriasis: generalized pustular and palmoplantar. And there is another third type that is called pregnancy associated pustular psoriasis, and it occurs specifically in pregnancy. It is a type of generalized pustular, but it specifically occur in pregnancy. And so these are the further types. Generalized pustular psoriasis, it is the severe condition. Why? Because it associates with fever, widespread erythema, so numerous sterile pustules. So all over the body there are sterile pustules, widespread erythema, that is redness all over the body. Patient might have a fever, toxic look, malaise, and systemic illness. Because since it's involved the whole skin, so this is a severe condition. Because our normal skin has three different functions. First of all, its first function is to maintain the barrier. Second is the fluid balance, and third one is the thermodynamic, that is it maintains the temperature of the body. So once the whole skin involved, then you get the disturbance of the all of these function. So patient might develop fluid imbalances, that is there might be electrolyte imbalances, fluid loss. Patient might develop thermodynamic disturbances like either hypothermia or hyperthermia. Patient might develop sepsis or infections, secondary infections, but they are not due to these sterile pustules. They are not due to the pustules, they are due to the generalized secondary infections. Like these pustules can be sterile at first, and later they can get infected because now the whole skin barrier is lost and the pathogens get access inside the skin. So this is a very severe condition. It is also called a dermatological medical emergency. So this medical emergency requires hospitalization. Why? Because it involves whole skin, and whole skin functions when gets disturbed, then it can becomes very severe. Okay, the next type is the palmoplantar pustular psoriasis. So it is specifically localized on the palms and soles. So you don't get these pustules all over the body. Instead, they are specifically localized to the palms and soles. Next section is erythrodermic psoriasis. What exactly is erythrodermic psoriasis? It is the most severe form of psoriasis. So this is the most severe clinical presentation of psoriasis, and it affects whole body redness. There is whole body redness, scaling, and temperature dysregulation. Okay, look at this picture. Okay, this is the severe form because it affects the whole body, just like I mentioned in the previous generalized pustular psoriasis. Whole skin, whenever whole skin gets involved, then you get severe form because now all of the skin normal functions will get disturbed. So there is whole body redness, scaling. You might see scaling here, but in specifically in other generalized pustular psoriasis and erythrodermic psoriasis. This is the difference, that in generalized psoriasis there will be redness all over the body, but the patient might have a pustules. Okay, but here the patient might have scale. So scaling and pustules will differentiate whether this is erythrodermic psoriasis or is it the generalized pustular psoriasis. So whole body redness occurs in both conditions. Scaling is the feature of erythrodermic psoriasis. Temperature dysregulation, hypothermia, fluid imbalances that also present in both cases. So complications are hypothermia, fluid loss, infection because of the disturbance of normal skin function. So once the skin is lost, just like it happens in the burns cases and in the other form of psoriasis, then you get the life-threatening condition. So it is also one of the medical emergency in dermatology. The erythrodermic psoriasis. Next is inverse psoriasis. It occurs in the skin folds, so specifically in the axilla, groin, under breast, gluteal region. So inverse psoriasis, instead of the typical presentation of the psoriasis, that specifically chronic plaque psoriasis. Chronic plaque psoriasis typically presents on the extensor surfaces, but this one presents in completely different areas, like in the skin folds, specifically in the skin folds, like axilla, in the groin region, under breast, and intergluteal clefts. These regions might get involved in inverse psoriasis. That's why we call it inverse, because the normal presentation gets inverse. This presentation depends upon the red plaques. You get red plaques, but no scaling. Why? Because these areas are mostly moist, and you get scaling on such areas where the skin is often dry. So since the skin is moist in these folds, so you get no scaling. Only red plaques. So red plaques in these regions, in skin folding regions, then you will see you can get inverse psoriasis. Next is another important type, that is just nail psoriasis. The features of nail psoriasis, let me tell you. Okay, look at this nail pitting. Nail pitting is one of the most important, you can say, clinical feature. Nail pitting, that means tiny depressions in the nail plate. So in the nail plate, this is the nail plate, and you get tiny depressions on this. And nail pitting is one of the feature of nail psoriasis, and it is associated with psoriatic arthritis. So if a patient presents with nails pitting or nail psoriasis, then he might also have psoriatic arthritis. So you must underlying check the underlying psoriatic arthritis, or must ask the patient about the any joint manifestations. Onycholysis means nail plate separate from the nail bed, just like here. So nail plate separate from the nail bed. This is called onycholysis, and onycholysis is also a feature of nail psoriasis. Oil drop or salmon patch sign. Salmon patch sign or oil drop sign. You can see here. This is like an oil drop inside the nail. So why does it happen? It happens because of the excessive skin cells. Once the skin cells start dividing again and again, and without any maturation phase, so you get the oil drop or salmon patch sign. And if you see oil drop sign or salmon patch sign, then this is a case of nail psoriasis. Subungual hyperkeratosis. There is hyperkeratosis due to the division of the cells. Okay, nail plate thickening can also occur. Buoy lines are also, and crumbling of the nails. So all of these are the features of nail psoriasis. And if you see patient with nail psoriasis, then you should also look for the psoriatic arthritis, because they are often intertwined with each other. Okay, next you see you have got psoriatic arthritis. This one is not exactly the cutaneous manifestation of psoriasis. Instead, it involves systemic, important thing, systemic involvement. This is specifically involvement of joints. So it doesn't occur in all of the patients, except it occurs only in 10 to 30% of patients. So some patients, specifically those who are having nail psoriasis, they might develop psoriatic arthritis. Okay, so these are the types, or you can say, look at these. Which joints will get involved in psoriatic arthritis? DIP, that is distal interphalangeal joints. So distal interphalangeal joints are the most common sites to get involved in psoriatic arthritis. Okay, and just asymmetrical arthritis. That means that the patient might have arthritis, that is the pain in the joints, and those joints may be oligo. That means more than two joints. So more than two joints may involve, and there will be asymmetric distribution. That means it doesn't need to happen symmetrically. Sometimes a patient might have involvement of the distal interphalangeal joint, or one limb and then another lower limb. Okay. So dactylitis is the entire finger or toe becomes swollen. So litis means inflammation. So if finger or toe becomes swollen, that is dactylitis. Arthritis mutilans, which is the severe case, and enthesitis. Enthesitis is basically the inflammation at the tendon and ligament sites, specifically at the Achilles tendon. So those sites, tendon and ligament sites, can also become inflamed. And these are the clinical features of psoriatic arthritis. So if you get any of these plus nail psoriasis, then you have got psoriatic arthritis. Important clue is that nail psoriasis plus joint pain. Which joints are involved in nail psoriasis? Specifically DIP, dactylitis, and enthesitis. That means tendon and ligament sites. These joints, and specifically asymmetric, there will be asymmetrical arthritis. So you must think of psoriatic arthritis. Now let's talk about the clinical challenge, because we have studied all the types of psoriasis, and now we are going to recall all of our knowledge that we have studied. Look at this. A 17-year-old boy presents with the sudden appearance of numerous small erythematous scaly lesions over his trunk and upper limbs. Okay, 17. Look at the age of the patient. That 17-year-old boy presents with sudden appearance of numerous small erythematous scaly lesions over his trunk and upper limbs. Distribution is trunk and upper limb. 2 weeks ago, he had a sore throat that resolved without treatment. So 2 weeks ago, he had a sore throat, that is, he had pharyngitis, and now that got resolved without treatment, and now he presents with the appearance of erythematous scaly lesions over his trunk and upper limb. Patient's age is 17 years. Okay, now what is the most likely type of psoriasis? So, of course, this one is the gutate psoriasis. The clinical cue point are that patient's age is 17 with he is a young adult. Okay, and he presented with numerous small like lesions over his trunk and upper limbs, and 2 weeks ago he had a sore throat. So all of these clues point towards the gutate psoriasis. Okay, our next clinical challenge is that a 42-year-old woman, so patient's age is 42-year-old, and presents with smooth bright red plaques in her axilla and groin. Smooth bright red plaques in her axilla, and distribution is axilla and groin. The lesions are small, sharply demarcated but have very little scaling, and we already talked what exactly is that. This is the inverse psoriasis. So it occurs in the skin fold region. It has little scaling and sharply demarcated smooth red bright plaques. Okay, so this one is the inverse psoriasis. Now let's talk about the next clinical challenge, that is a 50-year-old presents with multiple sterile pustules on an erythematous background. Okay, we have got pustules on erythematous background. She also has fever and feels generally unwell. So she is having fever and she feels unwell. This is called malaise. Okay, which type of psoriasis is most likely? This one is the plaque psoriasis due to generalized pustular psoriasis, because here you get pustules and erythematous background, and she is having fever and malaise. This is the generalized pustular psoriasis. Thank you very much. We will next talk about the management of the psoriasis as well as its trigger. Thank you.